I'm going to demonstrate a rapid trauma survey. So this is a rapid head-to-toe assessment on any trauma patient or unconscious trauma patient who you don't know exactly where the problem is. So if there is an isolated issue, like a stab to the foot, you wouldn't do a rapid trauma survey, you would do a focused exam. But on patients who are either unconscious or have major polytrauma, you can do a rapid trauma survey on any trauma patient, and the purpose is to try and assess and find all the life-threatening injuries as quick as possible. So this is after you have done your initial ABC. So we've already done airway, breathing, circulation. We know that those are controlled. Now we're doing all the other bigger bits. We're going to take our gloved hands, we're going to put it through the hair. Do we have any blood in our hands? Cool, no blood. We're going to look in the ears. Do we have anything, blood or fluid coming out of the ears? Do we have any bruising behind the ears? We're going to look in the pupils, shine our light in pupils. What are they doing? Are they constrict? Are they reactive? Are they pinpoint? What's going on? Do we have any bleeding coming out the nose or fluid coming out of the nose? We can then look in the airway if we want to, but we have already assessed airway. We're then going to check tracheal deviation if we want to. And then we can also look at any JVD. Do we have any jugular venous distension, even though this should be assessed with the patient sitting up slightly. Once you've assessed that, we're going to go into the chest. We're going to obviously open the chest. We're going to inspect. What do we see? Do we see any bruising or any bleeding on the chest or any wounds on the chest? Then we're going to palpate. So we're going to feel the chest. We're going to push on the ribs, feel as long as the ribs are all intact and the chest is intact. We're then going to percuss. So in between the ribs, with your wrist, are we hearing normal resonance, hyperresonance? Cool, so that's inspection, percussion. We're going to auscultate, so we're going to listen to the lungs. What are we hearing? Do we have good air entry? Once we've done the chest, we're going to go to the abdomen. We're going to feel the abdomen. Is it soft? Is it tender? Are we feeling any lumps or palpating masses? Cool, that feels good. Pelvis, we don't need to feel the pelvis. If there is enough trauma to break long bones or break ribs, if there's any sort of like major impact, we're not even going to feel the pelvis. We just put a pelvic binder on. We're going to feel long bones. We're going to feel tib fib, check pulses, check sensation, check movement in the feet if you can. Then you can do the same thing on the legs. Feel the long bones, feel the arms, and then you can check radial pulses. And that is a rapid trauma survey. By doing so, we're going to pick up on all the major things that are going to kill him quickly, and it also informs us of all the information that's happening. Once you've done this, then you can then roll them. If you are feeling like there might be something to their back, then you can also inspect the back quickly. And there you have it, rapid trauma survey.